on the importance of maternal and child nutrition. So before we move into, why is it important and how is it related, I thought I'll just tell you some of the statistics on the 2020 UNICEF Global Report. So, if we see this, what it means is that, um, we are well aware that amongst the countries across the globe, the ones, the low and middle income countries, are ones which are very prone and they have the population which is highly vulnerable and they do not have access to good food and nutrition. So this is where we understand that how things work in the underdeveloped nations versus the developed nations. So to just look at few numbers, as per the 2016 data of the total population of women, 613.2 million women in the reproductive age were facing or going or suffering through anemia, of which 35.3 million women were pregnant. So that makes it what? Like almost one sixth, yeah, close to, or maybe my math is bad, but it does make a significant population of women in the reproductive age and in women who are pregnant facing through anemia. So right now we just discussed that how important it is to treat anemia and how much of supplements are required in the body so as to prevent anemia during pregnancy and post pregnancy. But yes, this is how the stats look like. When we look at breastfeeding, it's only 42.2% of the infants in the age group of 0 to 5 months who are being exclusively breastfed. When you talk about the 2015 estimate for low birth weight, we see that nearly 20.5 million children are born with low birth weight. And moving to stunting and wasting, based on the 2018 data, we see that about 149 million children were stunted and 73.7.3% of them, equaling to about 49.5 million children were wasted. And again, from the same year, if we look at the data, we see that 5.9% children are overweight. So what does it mean? So, if you look at the stats, the numbers look very weird because you do not have a reference per se to, how it looks like. But on the broader outside, if you see, so the mostly what we are seeing is that, the maternal mortality, the number is decreasing. But when we talk about some of the challenges or some of the problems that the women are facing, anemia amongst women, amongst the pregnant women, is still something which is very much existing. And women in the reproductive age, pregnant women, are still a very significant population of those that fall under anemia. Talking about children, so wasting, stunting, overweight, these are all indicators that the children are not having proper nutrition. So if you just look at the last line with the data, what does it mean? You see broadly about what, 149 children. So there's a huge population which is stunted. There's a big population that is wasted and it's also overweight. So it's, we are seeing that over the years from 2015 report, when I see it at this 2020 report, yes, there has been improvement. But of course, depending on the lifestyle which we have and depending on a lot of other factors like lack of access to healthcare, lack of proper awareness of what should be taken in. Such are some of the reasons that even now we have women and children who are still not having proper nutrition. So these were just few broad numbers which I just wanted to put through so that we have an understanding on how maternal and child nutrition still looks like. So moving to the next slide, what are the causes? So we were, I think this is something which is very important for all of us to understand. So this is a very nice, you see on the left side, it's a very nice image which I got from the Aga Khan Foundation. So if you see, it's like a tree wherein your roots, your root says that what is the root problem. So if you see it, it's poverty and the status of women. So this is something when I'm talking about the causes, and taking it on few parameters like the socioeconomic context, then on the household context, and then we talk about the other factors. So if you see at the root, especially in a country like India and other developing countries, poverty is one of the major causes. People do not have even access to proper livelihood, proper sanitation, sanitation areas, proper hygiene. They are not able to afford food for themselves. So that is how people get trapped in poverty. So that is one of the major causes for women. That poverty, because of that, even though there are a lot of programs in India, they are they do not have access to it. So poverty, lack of knowledge, lack of awareness, and apart from that there is the other thing, which is the status of women. So you know my family belongs to Bihar. So if you go to Bihar in the rural areas or something, even now you would say that women are not even aware of how what services are being available to them, or how world has progressed. They are still shut behind doing the household chores. They are still put down. So because of that, they are not having that empowerment to understand what their requirements are and what they need to receive, especially during their pregnancy. So these two broad categories are basically the root of the problem where maternal undernutrition is. What does it go into? It leads to the reasons that do not have access to healthcare services. So because they're poor and they do not have that empowerment, they are not even aware of the services that are being provided to them. They stay in a dirty, unclean household area, then they fall sick, and they do not have proper sanitization, they do not have proper access to water, eventually falling into that trap of falling sick. And they once they are sick, and especially during that phase of pregnancy, their body becomes very prone to falling uh, you know prey to diseases, and that's it. They are undernourished, and so does that entire generation, because once they are undernourished, they are prone or susceptible to having babies which will be low birth weight. So that is one. The next thing that this can lead to is lack of proper care. So again, as we said that because of their root problem of poverty and whatever their status is, they do not even have proper care. Like even in their home, they do not have somebody to take care of them. And even once they have delivered, because of their malnourished conditions, they are not able to breastfeed the child exclusively, because they do not have the nutrient reserves in their body to feed the child. And the next thing is food, obviously, because their poverty is that one thing wherein you cannot have access to proper food and nutrition. So because of that, because of proper lack of proper calories, lack of right nutrients, it leads to malnutrition, and that's it's like an overall circle. So that's the reason I picked this picture. You see, it's like you have this basic cause at the ground level or at the root level. You see that the woman is not having that empowerment, she is not educated enough, she doesn't have that status, and they're poor. Because of that, they do not have the access, they do not have the knowledge, and they cannot have the food, which eventually leads to a malnourished female, which leads to a child with low birth weight. So this was broadly, I really like this picture. It kind of shows what actually the situation is. And a few years earlier, UNICEF actually designed a framework to understand or realize what nutrition or undernutrition, how are the causes and how it's related to. So if you see it on the right side, We're talking about the social and economical context, wherein it's related to your financial aspect, your capital. So again, if you're not educated enough, and if you do not have that status, you are when I talk about status, it's about empowerment for women. So those are the basic causes. Because of that, if you do not have good access to facilities, you do not have proper employment, you are you fall under the trap that how you have household food insecurity, and you have inadequate care, which eventually leads to unhealthy environment, wherein leading to further that you have poor dietary intake, you have a disease, and your body is immune to diseases, which eventually leads to undernutrition of both the mother and the child which is to be born. So you see it's all a vicious circle. That's why it's very important that the mothers, the pregnant women, they are, be it considering that you are poor enough, but currently there are so many programs being run, especially like in India. We have Poshan Abhiyan, we have WIVS. These are the programs which are being run by the government, which try to ensure that the pregnant women, at least they get the basic requirements during pregnancy, those minimum number of visits, the supplementation with iron and folic acid, their regular checkup. So there are programs that are trying to reach out to these women who are not having access. But yes, it is also somewhere the fact that there needs to be an increase in the awareness, and when patients come to you, it is important that they are being taught that just because they have access to healthcare and facilities, they should not be missing out on the fact that hygiene, food hygiene is very important. As we go with the improvement of food and the intake of good food, similarly, we also need to stick around with the fact that never ever should we compromise on the food hygiene. Be it a male or a female, be it be it any phase of your life where you are pregnant, not pregnant, you have delivered, food hygiene is something which is very important. So I thought that although we are in the middle of understanding what causes maternal nutrition, but this is something that throughout the session I would be wanting you all also to remember, which was on food hygiene. So broadly, we have understood that there are multiple factors, be it socio-demographic factors, be it poverty, be it access of healthcare services, be it uh, you know uh, the conditions, underlying systemic conditions in your body. These can be the broad areas where you say that lead to maternal undernutrition. But what is the impact of it? When we talk about the impact of it in mothers, yeah, it increases the chance of infection. So if you are undernourished, you will be prone to infection. Again, you have deficiency. One of the most common deficiencies which you can have as a pregnant female can be anemia. You can have eclampsia, and also leading to hemorrhage and death. Again, in children, how uh, it impacts if you are undernourished, if the mother is undernourished, there is a chance that the baby which is born is low birth weight. Because of the deficiency of nutrients, he or she might have birth defects, and over time there can be a neonatal mortality, under 5 mortality, and if the child survives and grows older also, because the base of the development has been poor, there's a chance that the child will always be malnourished, and they would belong to that category of being stunted growth or wasted. It might happen. So what happens is, if you look at like that, if a woman is malnourished or undernourished, it leads to a vicious cycle where the mother is not nourished enough, and it leads to a population which is again born, which is also kind of they do not have good nutrition, and their body is compromised. And just to look at another one of the facts, in South Asia, due to maternal malnutrition, uh, it's alone responsible for around 25 to 50% of intrauterine growth restriction. So what we saw earlier, that so many people were, or so many children were stunted or wasted. You see, one of the other reasons apart from chromosomal defects and demographic factors or other nutritional deficiencies, you also see that overall the maternal malnutrition is itself responsible for 25 to 50% of the IUGR, which makes it a big number. So this is another picture which I had, which is like a broad explanation of what has happened if the mother is not nourished enough. So you see that if a mother is not properly nourished, you will eventually have a higher chance of mortality of the female. the fetal the fetus is not nourished enough, the baby will be low weight. It will again have either once the baby is born, there might be a higher chance of mortality or impaired mental development, or growing older, there might be a higher chance of chronic disease risk, and eventually there might be infection. When the child grows further, you might have reduced mental capacity. So what it looks like is it's a vicious cycle. So it is imperative, or it's important that you are in a phase where you ensure that the population or the generation which is there gets good nutrition. At least as doctors, as at least as a public health professional, when I work in this field, what we see is that when we talk about nutrition, the maximum that it can be reached out to, how many people are getting impacted by it, how many people are we helping, with all these outreach programs that are being done, how many people get the nourishment. At the end of the day, it's somewhere, if the government is taking effort, and if there is a facility for you to utilize services, that is where you should ensure that every people, every female who's pregnant or an adolescent is ensured that he or like she can get the services to make sure that she can live a healthy life, even growing further. And the same applies even for males.